defect. Why complete? Because it has this ostium primum ASD and inlet VSD. Ostium primum ASD, you find interlateral septum and common AV valve. There is defect between this interlateral septum and common AV septal defect. So that is why we call it ostium primum ASD. Similarly, in case of inlet VSD, you find this interventricular septum and then VSD and then this common AV valve. That is the point to know. Interlateral septum ASD and then common AV valve. Interventricular septum VSD and then common AV valve. That is the point. Whenever you find this type of scenario, that is called common AV septal defect. Common AV septal defect means this valve is common for both mitral and tricuspid valve. So common AV valve with septal defect, interlateral septal defect, ventricular septal defect. So interlateral septum, ASD and then common AV valve. Similarly, interventricular septum, VSD and common AV valve. So in case of partial AV septal defect, either ASD or VSD is present. In case of ASD, that will be ostium primum ASD. In case of VSD, that will be inlet VSD. So whenever you find either inlet VSD or ostium primum ASD, that is called partial AV septal defect. So in case of partial AV septal defect, you will always find both mitral and tricuspid valve is coming from the same level. That is the point to know. In other type of BSD, you will not find both the valves at the same level. In other type of ASD, you will not find both the valves from the same level. So that is the point to know. You can see this is the mitral portion, this is tricuspid portion of common AV valve. Both are at the same level. So this same level, that means crux is absent. Crux means the portion of left ventricle and communicating with right atrium, that communicating that means contact with right atrium, that is atrioventricular septum, that is absent in this case. Crux of heart is absent in this case. That is the point to know. Next, color Doppler, you see in this case the most important point to know how much regurgitation is happening across this tricuspid side and mitral side. You can see the tricuspid side is having severe regurgitation and mitral side has also mild regurgitation. You can see this mitral side, this is tricuspid side. So you have to find out regurgitation. One point, common AV septal defect, you will find both ASD and VSD. Then that will be common AV septal defect, partial either ASD or VSD. Second thing, how much regurgitation is there from right side, from left side. Then what is the size of VSD, what is the size of ASD, how much the chamber enlargement, how much ejection fraction on right side and left side. That is the point to know from this case. Again, this is common AV septal defect. Same thing, you can see this mitral portion of AV valve regurgitation. This is tricuspid side of AV valve regurgitation. Severe AV valve regurgitation needs early surgical procedure. Again, you see this is pulmonary valve. Obviously, no flow obstruction across pulmonary valve. So in this case, what will happen? More flow to pulmonary circulation ultimately will lead to pulmonary artery hypertension, and pulmonary artery hypertension will finally get irreversible pulmonary artery hypertension. In the beginning it is reversible, finally it becomes irreversible. That is called pulmonary vascular resistance increases after long time if patient of surgery is not performed on the patient to correct the anatomical problem. Again, this is apical 4-chamber view. This is ostium primum ASD. Similarly, see just this is interlateral septum, then ASD, then common AV valve. This is interventricular septum, VSD, and common AV valve. And both valves are coming from the same origin, or you just simply sit at the same level, you say, because it's common, so it has to come from the same level. Again, the same thing. This is apical 4-chamber view. This is tricuspid side. This is mitral side. The valve is common. You can see this portion is common. Again the same thing. Or sometimes this is a transitional AV septal defect. In that case, this is not the case. This is complete AV septal defect, the classical one. In case of transitional AV septal defect, what we will find? This is ostium primum ASD. That will be easily seen. Then very small inlet VSD. So ultimately, what you will find, the both valves are coming from the same level, so that is absence of left ventricle and right atrium septal portion is absent in that case, because both valves are coming from the same level. So that scenario does not happen. You will find very small inlet VSD and ostium primum ASD, and here the valve is coming separately from the similar point. So in that case, that is called transitional AV septal defect. This is complete AV septal defect. Thank you.